Hi there, this is Ben with HCO-HCRIS, and today we're going to talk about our home health agency financial data. All of the data is derived from the HCRIS cost reports from CMS, and our modifications include aggregating subscripted lines, cost-coding relevant worksheets, and giving relevant variable names, as well as stacking it to make a longitudinal data set. In terms of the specific data sets that we offer, there's two of them. There's our overall HCRIS data set, which has for home health agencies, it has about 600 plus variables. Then there's our financial health data set, which has a smaller subset of core HCRIS variables, as well as ratio calculations and outlier identification. Going into a little more detail about CMS's healthcare cost report information system, basically used to formulate the cost of providing care to Medicare and Medicaid patients. The idea is basically to compare what was actually paid to the expected cost of providing treatment. Uses a step-down methodology to find the costs, classifies expenses as either allowable or non-allowable. Costs are allocated into groups to find a cost-to-charge ratio for each grouping. The cost reports are organized into alphanumeric worksheets. So below on the left are some of the worksheets that we include. Utilization, worksheet A, classification of expenses. This is what we were talking about from before. And then C is the cost to charge ratio. D is reimbursement. And then F is balance sheet, unlike others where it's usually the G series. And on the right, you can see an example from worksheet A, which is some of the HHA Home Health Agency reimbursable services. For home health agencies, there are two separate forms. The first one started in 1728-94, and then forms switched in 2020. So that's 1728-20. What was the change? The main change is breaking out revenues by payer type. So before it was just sort of aggregate. Now it's broken out Medicare, Medicaid, etc. As I mentioned, there's quite a few variables, not as many as skilled nursing facility or hospitals, but there's still around 628 total variables right now. Fiscal year and time range will vary. I always say this, that some fiscal years are calendar year, so January to December, whereas others are start in the summer, so July to June. Our financial health dataset contains a subset of the HCRIS variables, pretty much all the F series, so all the financial variables, utilization variables, and then some summary cost variables. In addition, there's a variety of common ratio calculations for the healthcare industry. Examples down below, average length of stay, which isn't really applicable for home health agencies, but some of the others are. And then in terms of outlier identification, this is done within each annual release of the HCRIS forms. Like providers are compared with like providers within variables. And then, so small, medium, and large size for home health agencies, I believe it's done by visits. And then those Z-scores are calculated. And this is just to let the user know if there's any extremely large outliers in the data. Looking at the HCRIS data table, it's important to note that this is only data for the last 5 years, given the size of the database. Again, it's going back to 1994. There's not as many variables as other provider types that we carry, but still it's a lot. So data table browsing is limited here. And then scrolling down to the documentation, here in the measure description column, you can see which worksheet the variables were taken from. And finally, taking a look at the Home Health Agency Financial Health dataset. Again, similar to the HCRIS, but below where key variables are included. Again, you can see the worksheet where it came from. And then if it is a ratio calculation, you can see the calculation here as well. And that about wraps it up. Please let us know if you have any questions, and thank you for watching.